My name is Donald Davis. I go by Donnie. I'm from Bells, Tennessee. I'm a country boy at heart. I've been on FUROSCIX for a year and love it. The primary thing I love about FUROSCIX is I get to stay at home and do it. I don't have to run back and forth to a hospital for help. FUROSCIX is simple to use, it's effective, and you stay at home watching TV all you want to and play with your dog. Bells is a small, rural town, probably 3,000 people, very small. My grandfather was a cop there for 50 years, so I grew up there with a police family. Bells is about 75 miles north of Memphis and probably 150 miles from Nashville. My days usually are taking care of my dog. Radar, white German Shepherd, beautiful. It showed up on my doorstep one day about 3 years ago. All older people are going to have something else go with it. I happen to have MS. And that I was diagnosed with MS in '06. It's been, I handled that for quite a while. I was still working for a while. But when heart failure came on, that kind of changed things dramatically. Heart failure's been tough over the years. First thing you notice, you wake up, you can't breathe. Hard to get your breath and hard to get up, and your energy level is way down. So because your heart's working so hard to pump the fluid off. When the fluid builds up too much before I was on FUROSCIX, it's necessary to go somewhere for help. My girlfriend ended up being the one taking me to the hospital all the time because sometimes I wasn't able to drive. Because the fluid buildup does affect several different things about your body. And this 2-hour drive to Nashville, because that's where I go to the doctor for my main doctors. When they finally transferred to Jackson and they put me on FUROSCIX, that changed my trips to Nashville. Really solved an issue there. Yes, my NP started noticing that the torsemide and furosemide was not working well as they wanted it to, and brought up a new product at the time called FUROSCIX. Being an injectable, an infusion type product, but I wouldn't be willing to try to. Sure, anything that helped me, because I needed help at the time. FUROSCIX is very simple to use. It times itself and turns itself off in 5 hours. Put it on my stomach right here in the fatty parts. Simple to put on, simple to remove. Within 15, 20 minutes, you usually jump up and go to the restroom. It's pretty fast. And you feel the results of it pretty fast too. Otherwise in your body. You know when your fluid's leaving. You can breathe better. The 5 hours of FUROSCIX has changed the time I spend in the hospital and the trip there and back. So it's eliminated a lot of time that I've spent elsewhere. More time at home, right, all right. Radar loves me.
What is FUROSCIX, furosemide injection, for subcutaneous use? FUROSCIX is a prescription medicine used to treat fluid buildup, which can cause congestion or swelling, also known as edema, in patients with chronic heart failure or chronic kidney disease. FUROSCIX should be replaced with oral diuretics as directed by a healthcare provider. Follow the instructions provided by your physician when taking FUROSCIX. Important safety information. Before taking FUROSCIX, read the instructions for use and tell your healthcare provider about all your medical conditions, including if you have trouble urinating, are allergic to furosemide, or any of the ingredients in FUROSCIX, or if you are allergic to medical adhesives. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. FUROSCIX and other medicines may affect each other, causing side effects or change how the medicines work. What are the possible side effects of FUROSCIX? Dehydration. FUROSCIX can cause you to lose excess water and electrolytes. Symptoms of excess water and electrolyte loss include dry mouth, increased thirst, muscle pains or cramps, decreased urine output or urine more yellow than normal, headache, dry skin, nausea, or vomiting. Your healthcare provider may check your electrolytes while receiving FUROSCIX. Low blood pressure. FUROSCIX may cause your blood pressure to decrease temporarily. You may feel lightheaded or dizzy, particularly when standing up. Getting up slowly may help. High blood sugar. If you have diabetes mellitus, FUROSCIX may increase blood glucose levels. Loss of hearing. FUROSCIX can cause ringing in your ears. Tell your healthcare provider if you have trouble hearing while taking FUROSCIX. Incomplete dosing. If you do not receive a full dose because the on-body infuser got wet, came off the skin, or there was an alarm, call your healthcare provider for more instructions. Do not apply a new on-body infuser unless instructed to do so by your healthcare provider. The most common side effects with FUROSCIX are administration site and skin reactions such as bruising, redness, swelling, and infusion site pain. These are not all the possible side effects of FUROSCIX. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see the full prescribing information, www.furoscix.com/prescribing-information.pdf, and use instructions for use. www.furoscix.com/instructions-for-use.pdf.